Dr. Ennis, let me ask you, are you, when a person comes, headache is another one of those big things. And of course, there are a million of reasons, and there's no way we're trying to diagnose here and down why people get a headache, but that'd be impossible. But you do deal with headaches quite a bit, right?
We certainly do. We don't see those related to workers' comp injuries, but we see those related to private cases. There's no question about that.
Right, and the people who came for workman's comp but then stayed, etc. In fact, sometimes it looks like by talking to you, I heard that people get rid of the headache, which they had for a long time, because they came to you for a workman's comp, which happened only a week ago, simply because you somehow straightened out their body, which is now coordinated, and by pure accident, you also got rid of the headache. Right?
It's not correct. It's not uncommon for patients to come back to us privately after we've taken care of their injury. It's always a compliment to us, and we certainly encourage that with patients.
Right. So let's talk about this headache business, and let's talk about it from one aspect. By talking to you, I found out that a fair amount of headaches come because their jaws, their teeth are not quite aligned, which might have happened because they had a few missing teeth for too long and it got misaligned. Their teeth might just have grown badly. And frankly, as you said, when people have a car accident, a back flash or whatever they call that, the hinges here, which apparently are one of the most complicated hinges in the body because they move in 3 dimensions literally, which most other hinges don't, can be coming out of alignment, and next thing you know is the person starts having shoulder pain, lower back pain, neck pain, and even severe kind of headaches. And you told me that if whatever normal treatments don't quite fit, that one of the first thing you do is get a patient referred to a dentist to check whether his bite is correct. Can you shed some more light on that whole thing and why you would want to do such a thing?
Well, certainly problems related to TMJ syndrome are difficult to diagnose at times.
And DMJ, I know it has a very long word which I cannot pronounce, but those are those hinges here, right?
That's correct, the temporomandibular joint. When there are problems with that joint in which it becomes dislocated and has to be relocated, or it's subluxed, which is partially dislocated, it can cause some pain that radiates up to its origin. And when that occurs, there are things that dentists can do and oral surgeons can do that to alleviate that, sometimes by way of placing things in a person's mouth so that the jaw is pulled forward a little bit. Sometimes even surgery is required. And so those that are in oral surgery or dental medicine can offer a patient quite a bit that have TMJ syndrome.
Yeah, those things they place in the mouth, I think those are almost like mouth guards so that the person doesn't clinch as bad as he used to. Now, however, then sometimes those dentists in turn even send the people or you kind of like also do that you send the people to a physical therapist and or a chiropractor because of the thing being out of alignment here for so long, it kind of like tensed up the muscles sometimes all the way down to the back pain. Is that, that looks pretty severe to me. I mean, a little tiny mouth like here, kind of like getting muscles all screwed up all the way down to the back.
That's true. Oftentimes a neck pain or a rostral headache, the root of which can go back to problems with the TMJ area. TMJ pain is difficult to diagnose sometimes. And when a patient has that problem can radiate or can cause problems in many different areas. Certainly once a patient becomes in pain, they become tense and the muscles become tight. In any area where their muscles become tight, and that usually represents the neck, sometimes the upper back, some shoulders, those areas that have the muscle spasm can have pain.
Okay. So basically, the synergy of several treatments, maybe whatever you as an MD suggests from in terms of medicines, in terms of whatever is available, but then there is straighten out, all the body parts which are not aligned, which is part of it is dentist, part of it is physical therapy or chiropractor or that type of stuff, and then it's the togetherness which has the best chance of surviving with a patient. Is that what you're saying?
Most definitely. Taking a multidisciplined approach to any patient that has severe headaches is really important. Diagnosing the cause of headaches and diagnosing the cause of facial pain is difficult at times.
All right. Well, very informative again. It's quite a different look at like headaches having to do with your teeth without them being hurting, I know that a tooth hurting can cause a headache, that's for sure, but we're talking a different type of hurting, and it's very, very informative.
Yes.
Certainly,
I was going to say that having good oral hygiene is very important to having good health. A person that has multiple dental caries of the mouth and does not have good oral hygiene every time they brush their teeth, the bacteria associated with that infection spreads throughout their whole body. So it's really important to manage your teeth very, very well.
Well, I've heard that. It's interesting that you mentioned that. I've heard that before, that for instance surgeons, and you being in the trauma care, you probably have are very, very interactive with surgeries, smaller ones and even bigger ones as they maybe move on, to need some surgery because they're very badly damaged. That many surgeons these days, over the last few years only, demand a clean bill of health in terms of gum disease from the dentist before they attempt surgery, because they say if you have a gum disease, your immune system, your whole body is so weak already that if we go and cut in this other part of the body might not take it, and we may complicate the whole surgery in a way we don't have to if you first get your other infections cured. Is that what you're referring to also?
Yes, most definitely. Actually, in our urgent care facility, we do preoperative evaluations for surgeons, particularly orthopedists and some general surgeons. And one of the things we look at is what kind of oral hygiene is present. And if there's poor oral hygiene, their surgical risks are always higher. And a decision needs to be made. Should we proceed with surgery, or should we get the dental problem fixed before surgery? Certainly having good dental health is very, very important for any person, and particularly when that person is getting ready to face surgery, or if that person gets another medical problem. Having proper oral and good oral hygiene is important even in those circumstances. Anytime a person's immunities are compromised, having good oral hygiene is important.
Well, I've heard that your doctors see, and you probably don't deliver too many babies in your urgent care facility, but you do see, you are a primary care physician for many people, that that just the total immune system is going down. Ladies get premature babies because of it. And those babies are sometimes heavily underweight. And as you said, other medical problem, like what about the next flu season? I mean, if you already have an infection in your body, your immune system ought to be a little weakened. All the soldiers are there fighting that infection, whether that infection is in your stomach, in your lungs, or in your gums, don't really make a big difference. They're used up, and they cannot fight a new invader, a new virus, or whatever it might be.
Certainly when a person has multiple areas of infection, and certainly the poor dental hygiene can be one of those, it compromises them. There's no question about that. So everything that you say is correct.
Dr. Ennis, thank you very much.